Facilitation and group development. Facilitation is a crucial process in managing and guiding groups, especially in professional and organizational contexts. It involves techniques and strategies to encourage participation, foster open dialogue, and ensure productive outcomes from group activities. Understanding the dynamics of group development is vital for effective facilitation. One of the foundational models for understanding these dynamics is Bruce Tuckman's stages of group development. Bruce Tuckman's stages of group development. Bruce Tuckman introduced his model of group development in 1965, which outlines 4 distinct stages: forming, storming, norming, and performing. Each stage represents a phase through which a group typically progresses to become effective and cohesive. 1. Forming. In the forming stage, group members are introduced. They start to understand the tasks at hand and begin to know one another. This stage is characterized by a high degree of guidance needed from the leader or facilitator, as members are often unsure about their roles and responsibilities. 2. Storming. The storming stage is marked by conflict and competition, as group members start to push against the boundaries established in the forming stage. This phase can be disruptive and challenging, but it is essential for the growth of the group. The facilitator's role here is critical in helping the group manage conflicts and ensuring that this struggle for roles does not become destructive. 3. Norming. Once the group navigates through the storming stage, it enters the norming phase. During this stage, members resolve their differences, appreciate colleagues' strengths, and respect the authority of the leader. Norms and rules are established, and the group starts to work more effectively together. The facilitator supports the development of mutual respect and helps establish protocols during this stage. 4. Performing. The final stage of Tuckman's model is performing. At this point, the group is fully functional and works efficiently towards achieving its goals. The role of the facilitator shifts towards maintaining positive dynamics and fostering an environment that continues to encourage productivity and creativity. The facilitator's role and mission. The facilitator's mission is to guide the group through each of these stages, ensuring smooth transitions and addressing any issues that may hinder progress. The facilitator's role varies depending on the stage of group development. During forming, act as a directive leader to define goals and roles. During storming, employ conflict resolution skills to address challenges and teach the group constructive communication practices. During norming, support the establishment of rules and norms that will help the group function effectively. During performing, step back and let the group take more control, intervening only when necessary to facilitate high performance. Effective facilitation is about more than just moving the group through stages. It's about creating an environment where each member feels empowered to contribute their best. This involves not only a deep understanding of group dynamics as described by models like Tuckman's, but also a strong set of interpersonal and communication skills. Tuckman, 1965. Support groups. Support groups play a pivotal role in the recovery and ongoing stability of individuals dealing with mental health and substance use disorders. These groups provide a unique platform for recovery that is often peer-based, anonymous, and free of charge, making them accessible and appealing to those in need. Characteristics of support groups. Peer-based. One of the core characteristics of support groups is that they are peer-based. This means that the groups are composed of individuals who are, or have been, in similar situations. The peer-based approach allows members to relate to one another on a deeper level, based on shared experiences and mutual understanding. This shared experience fosters a sense of community and belonging, which is often crucial in recovery processes. Anonymous. Anonymity is another fundamental aspect of support groups. It assures members that their personal struggles and stories shared within the group will not extend beyond the room. This assurance encourages openness and honesty in discussions, which is vital for effective healing and support. Anonymity also helps in reducing the stigma associated with mental health and substance use disorders, making it easier for individuals to seek help without fear of judgment or repercussions. Cost. Accessibility is key in making support effective, and one of the ways support groups ensure accessibility is by often free of charge or at a low cost compared to one-on-one support. This removes financial barriers that could prevent individuals from seeking help. By providing services without cost, support groups ensure that anyone who needs help has the opportunity to receive it, regardless of their economic situation. Impact of support groups on recovery. Support groups are not just a place to share experiences. They are a critical component of the recovery process. They provide emotional support, understanding, and validation, which are essential for individuals facing mental health challenges and addiction. The support obtained in these groups often leads to significant positive changes in coping strategies and overall mental health. Participants in support groups typically gain various benefits. Empowerment and control. Engaging with peers who understand one's struggle empowers individuals. It provides them with multiple perspectives on common problems and diverse strategies for coping, giving them a greater sense of control over their recovery journey. Enhanced coping skills. Through regular interactions, participants learn new ways to cope with their stressors and triggers. This learning is often facilitated by observing and discussing the successes and failures of peers in the group. Reduction in isolation. By meeting others with similar challenges, individuals often find relief from the isolation they may feel due to their disorders. This social aspect can significantly improve one's mood and outlook. Sustained recovery. Support groups provide ongoing support that can help sustain recovery long-term. The continuous nature of the support helps prevent relapse, as members can seek help from the group at any sign of trouble, ensuring ongoing stability and support. Recovery peer support. Groups and activities. In addition to individualized check-ins, comprehensive peer recovery support services, PRSS, programs encompass a variety of group-based activities aimed at promoting holistic recovery. These activities provide opportunities for education, skill building, emotional support, crisis prevention, and community connection. Structured peer support groups. Structured peer support groups follow a predetermined format and focus on specific topics or themes related to recovery. These groups offer a supportive environment for individuals to share experiences, learn from one another, and receive guidance from trained facilitators. Structured peer support groups are designed to provide targeted support by focusing on specific topics or themes that are relevant to the participant's recovery journey. Here are some examples of such groups. 1. Addiction. Recovery groups. These groups focus specifically on discussing challenges and strategies related to overcoming various types of addiction, such as alcohol, drugs, or gambling. 2. Mental health support groups. Dedicated to individuals dealing with mental health issues like depression, anxiety, or bipolar disorder. These groups provide a space to discuss coping mechanisms, medication management, and lifestyle changes that support mental health. 3. Grief support groups. aimed at individuals who are coping with loss, whether it's the death of a loved one, the end of a relationship, or any other significant loss. These groups help participants process their grief and find support among others who are experiencing similar emotions. 4. Parenting support groups. For those in recovery who are also navigating the challenges of parenting, these groups provide a platform to discuss parenting strategies, child development, and how to balance recovery with parenting responsibilities. 5. Relapse prevention groups. These groups focus on identifying triggers, discussing strategies to prevent relapse, and providing support to maintain long-term recovery. 6. Employment support groups focus on challenges related to finding and maintaining employment during and after recovery. Topics may include job search strategies, interview preparation, and balancing work with recovery needs. 7. Stress management groups, dedicated to teaching and practicing stress relief techniques such as mindfulness, meditation, and time management to help participants handle daily pressures without resorting to substance use. 8. Health and wellness groups. These groups often focus on physical health, nutrition, and exercise, discussing how a healthy body can support a healthy mind, particularly in recovery. 9. Legal issues support groups. For individuals whose recovery journey is complicated by legal issues, these groups provide a space to discuss navigating the legal system, understanding rights and responsibilities, and finding legal assistance. 10. Dual diagnosis groups, catered to individuals who have both substance use disorders and mental health conditions, offering a supportive environment to discuss the complexities and unique challenges of dual diagnosis. Semi-structured peer support groups. Semi-structured groups combine elements of both formal structure and informal interaction. While they may have designated topics or activities, there is flexibility for open discussion and sharing among participants based on their needs and experiences. This model can be especially helpful when structured groups fail to address some of the things that the individual may feel they need to address and gives voice to the individual. 1. Recovery and resilience groups. While these might start with a focus on strategies for maintaining sobriety or managing symptoms, discussions can naturally evolve based on the current challenges or successes that participants wish to share, providing a tailored support experience. 2. Transition support groups. Designed for individuals navigating significant life transitions, such as moving from rehabilitation facilities to everyday community life, returning to work after recovery, or shifting from active treatment to maintenance. The structure allows for the discussion of practical strategies while adapting to the varied personal experiences and emotional states of the group members. 3. Women's or men's groups. These groups focus on issues specifically related to gender experiences in recovery, such as societal expectations, personal identity, and family dynamics. While they may start with a topic, the sessions allow participants to bring up issues pertinent to their specific gender-related experiences and challenges, fostering deeper discussions and peer support tailored to their unique perspectives. 4. Young adults groups. Tailored for younger individuals who are in recovery, these groups often start with topics relevant to this demographic, such as peer pressure, academic stress, or early career challenges. The semi-structured format allows young adults to guide the conversation towards issues they find most pressing or relevant, creating a more engaging and relatable support environment. 5. Healing groups. These groups may begin with discussions or activities centered around holistic practices like yoga, meditation, or nutrition, but participants are encouraged to share their own experiences and explore topics beyond the initial scope, such as personal spirituality or alternative therapies. 6. Veterans support groups. Focusing initially on common experiences like adjusting to civilian life or coping with PTSD, these groups allow veterans to diverge into discussions about personal experiences, challenges in family dynamics, or professional integration that might not be covered in a fully structured session. 7. Creative expression groups. While these may start with specific creative activities like writing, painting, or music, the sessions provide flexibility for participants to explore and discuss how these activities impact their emotional well-being and recovery journey, leading to open-ended discussions about personal expression and healing. 8. Family dynamics groups. These sessions might begin with discussions on common family-related issues in recovery, such as establishing boundaries or communication strategies. However, the semi-structured nature allows members to delve into specific personal family situations and seek advice or share experiences that are unique to their circumstances. Educational workshops and health education sessions. Educational workshops and health education sessions provide participants with information, skills, and resources to support their recovery journey. These sessions cover topics such as addiction, science, relapse prevention strategies, educational about mental health disorders, stress management techniques, and healthy lifestyle choices. Here are examples of educational workshops and health education sessions that can support participants in their recovery journey. 1. Addiction science workshops, sessions that delve into the biological and psychological aspects of addiction, helping participants understand the scientific factors behind their behaviors and the mechanisms of dependence. 2. Relapse prevention strategies, classes focused on teaching techniques such as recognizing triggers, developing coping strategies, and creating personal action plans to prevent relapse. 3. Mental health disorder seminars, providing comprehensive information about specific mental health disorders, treatments available, and strategies for managing symptoms in daily life. 4. Stress management workshops, teaching various techniques such as deep breathing exercises, mindfulness meditation, progressive muscle relaxation, and time management to help participants cope with stress effectively. 5. Healthy lifestyle choices, sessions covering topics like nutrition, exercise, sleep hygiene, and the importance of regular medical checkups to maintain physical health, which supports overall well-being. 6. Financial management for recovery, educating participants on budgeting, managing debts, and financial planning to reduce stress related to financial issues during recovery. 7. Social skills development, workshops focused on enhancing interpersonal skills, communication techniques, and building healthy relationships, crucial for a supportive social environment during recovery. 8. Job readiness and career planning workshops, offering guidance on resume building, interview skills, job search strategies, and career planning to support reintegration into the workforce. 9. Legal rights and resources, seminars providing information on legal issues that might affect individuals in recovery, such as dealing with past convictions, understanding rights under the law, and accessing legal support. 10. Mindfulness and meditation retreats, intensive sessions focused on practicing mindfulness and meditation to enhance emotional regulation and self-awareness, key components of long-term recovery. Stress and emotional management activities. Stress and emotional management are crucial in helping individuals navigate the challenges of daily life, particularly for those recovering from mental health issues or substance use disorders. Activities designed to manage stress and emotions equip individuals with essential coping strategies, allowing them to handle difficult emotions and situations more effectively without resorting to substance use. Types of stress and emotional management activities. Mindfulness practices. These include techniques such as meditation, deep breathing exercises, and yoga. Mindfulness helps individuals center themselves in the present moment, reducing stress and promoting a calm, focused state of mind. For instance, guided meditation sessions can help members of a support group learn to manage anxiety and stress through controlled breathing and mental imagery. Relaxation techniques. Techniques such as progressive muscle relaxation, biofeedback, and guided imagery are used to physically and mentally relax the body. These methods help reduce the physical symptoms of stress and anxiety, leading to a more relaxed and peaceful state of mind. Expressive arts therapy. This form of therapy utilizes art, music, dance, and writing to help individuals express themselves creatively. By engaging in expressive arts, people can explore emotions that might be difficult to verbalize, offering a therapeutic outlet for stress and complex feelings. Group discussions on emotional regulation. These discussions provide a platform for individuals to share their experiences with managing emotions and to learn from others. By discussing different emotional regulation strategies, group members can gain insights into how to handle their emotions in various situations effectively. Important emotional management talking points. When facilitating activities focused on stress and emotional management, several key talking points can enhance the learning experience. Understanding triggers. Discussing what triggers stress or negative emotions helps individuals recognize and anticipate situations that may challenge their emotional stability. Recognition is the first step in developing effective coping strategies. The role of physical health in emotional well-being. Emphasizing the connection between physical health and emotional health can motivate individuals to maintain physical activity, proper nutrition, and adequate rest, all of which are important for emotional regulation. Developing a routine. Encouraging the development of a daily or weekly routine that includes dedicated time for stress. Reducing activities can help individuals maintain emotional stability. Consistency is key in managing long-term stress. The power of positive thinking. Introducing techniques for reframing negative thoughts into positive ones can significantly impact how individuals perceive and react to stressors. Emergency coping strategies. It's also useful to discuss emergency coping strategies that can be employed in particularly stressful situations, such as STOP technique. Stop, take a breath, observe, proceed. Crisis prevention and intervention. Crisis prevention activities aim to identify and address potential triggers or risk factors for relapse before they escalate into crises. Peer support groups may provide opportunities for participants to discuss challenges, receive peer feedback, and develop personalized crisis prevention plans. Wellness Recovery Action Plan. Participants learn to develop their own comprehensive, personalized recovery and wellness plans, which include identifying early warning signs and devising crisis intervention strategies. Trigger identification sessions. Workshops focused on helping participants recognize their personal triggers and develop strategies to manage them before they lead to a crisis. Coping skills training. Sessions that teach a variety of coping mechanisms, such as cognitive behavioral techniques, emotional regulation skills, and problem-solving strategies to prevent crises. Emergency contact planning. Workshops that assist participants in creating a list of emergency contacts, including peer supporters, family members, therapists, and crisis hotline numbers. Role-playing scenarios. Interactive sessions where participants engage in role-playing to practice how to handle potential crisis situations effectively, reinforcing their crisis intervention skills. Mindfulness-based stress reduction classes. Teaching mindfulness practices that help participants maintain calm and composed reactions in potentially triggering situations. Safety planning workshops. Facilitated sessions where participants develop personalized safety plans that outline specific steps to take during a crisis to ensure personal safety and well-being. Medication management education. Providing information about how proper medication management can prevent crises related to mental health conditions and substance use disorders. Stress management techniques. Workshops. Teaching stress reduction techniques to prevent stress from escalating into a crisis, including relaxation exercises and time management skills. Peer feedback sessions. Regular meetings where participants can discuss ongoing issues and receive supportive feedback and strategies from peers to prevent potential crises. Community building activities. Community building activities foster a sense of belonging, connection, and social support among individuals in recovery. These activities promote bonding, peer bonding, and collective resilience within the recovery community. Regular meetups. Organizing regular social gatherings or meetups for group members to share experiences, celebrate milestones, or simply enjoy social interactions. These could be coffee meetups, group dinners, or picnics. Workshops and seminars. Hosting workshops or seminars on topics relevant to recovery, wellness, and personal development. These events not only provide education, but also bring members together around common interests. Group projects. Engaging members in group projects such as community gardening, volunteering for local charities, or participating in community cleanup days. These projects encourage teamwork and a sense of accomplishment. Peer mentorship programs. Establishing a mentorship program where more experienced individuals in recovery mentor newcomers. This can enhance feelings of responsibility and belonging among mentors and provide crucial support to mentees. Recreational sports or activities. Organizing team sports or group activities such as hiking, bowling, or yoga classes. Physical activity can be a powerful tool for building camaraderie. Shared learning experiences. Creating book clubs or study groups that allow members to learn together and discuss topics of mutual interest, supporting both intellectual engagement and social interaction. Celebration events. Hosting events to celebrate recovery milestones, birthdays, or other significant dates. Celebrations can strengthen group cohesion and provide positive reinforcement. Support group meetings. Regular support group meetings where members can discuss their challenges and successes in a structured environment promote a sense of shared journey and mutual support. Art and music nights. Organizing nights where members can display their artistic talents or enjoy performances together. This can be an expressive and therapeutic way to build community. Online forums or social media groups. Creating online platforms where members can stay connected, share resources, and support each other outside of face-to-face meetings. Applying motivational interviewing to support groups. Critical to facilitating groups is proper application of motivational interviewing skills. As motivational interviewing was discussed, is RRPS recovery and mentorship. Seminar 1, and you may be taking this facilitator course without having completed Seminar 1. We restate here the basic tenets of motivational interviewing. Principles of motivational interviewing. Motivational interviewing, MI, is guided by several key principles that form the foundation of its approach. These principles are essential for fostering a collaborative and client-centered conversation aimed at eliciting and strengthening individuals' motivations for change. Let's explore some of the core principles of motivational interviewing. 1. Express empathy. The first principle of MI is expressing empathy, which involves understanding and empathizing with the individual's perspective, experiences, and emotions. Empathy creates a supportive and non-judgmental environment where individuals feel heard, understood, and respected. By demonstrating empathy, facilitators build trust and rapport, enhancing the effectiveness of the interaction. 2. Develop discrepancy. MI focuses on exploring the discrepancies between individuals' current behaviors or circumstances and their desired goals or values. Facilitators help individuals recognize and amplify these discrepancies, highlighting the misalignment between their current actions and their aspirations. This discrepancy motivates individuals to explore and consider making positive changes in their lives. 3. Roll with resistance. Resistance is a natural part of the change process, and MI acknowledges the importance of responding to resistance with empathy and acceptance rather than confrontation. Facilitators roll with resistance by avoiding arguments, defensiveness, or power struggles. Instead, they validate individuals' concerns, explore underlying reasons for resistance, and gently guide them towards considering alternative perspectives. 4. Support self-efficacy. Self-efficacy refers to individuals' belief in their ability to make meaningful changes in their lives. MI aims to bolster individuals' confidence in their capacity to change by acknowledging their strengths, resources, and past successes. Facilitators provide affirmation, encouragement, and support, empowering individuals to take ownership of their change process and build confidence in their ability to achieve their goals. As mentioned before, incorporating strong communication skills like active listening, using open-ended and permission questions, validation, relating statements, reflective statements, summarizing, and using positive body language is critical to helping a person explore their own motivations. By using these skills within MI, mentors empower mentees to explore their goals, boost self-confidence, and make positive changes in their recovery journey. Goals. FE. In life, we have big goals and smaller steps, called instrumental goals, to reach those big goals. The Goals FE framework is a robust approach to effective communication and goal setting in a peer support or coaching context. Here, we'll delve deeper into how each component of this model can be effectively utilized, with practical examples and insights on their benefits. The G in goals stands for goals. Setting clear, achievable goals is the starting point. Goals should be specific, measurable, achievable, relevant, and time-bound. SMART. In practice, this means helping individuals articulate what they hope to achieve in precise terms, determine how they will measure their success, ensure the goals are realistic, align them with broader life values, and set a deadline for achievement. Clear goals provide direction and a sense of purpose. They help individuals focus their efforts and make consistent progress, even in small steps, towards a larger objective. O in goals stands for open-ended questions. Open-ended questions are designed to encourage a more detailed and thoughtful response. Encourage a more thoughtful and detailed response, rather than a simple yes or no answer. For example, instead of asking, "Did you feel better today?" you might ask, "What did you feel today? And what do you think influenced those feelings?" These questions help in exploring the depth of an individual's thoughts and feelings. They facilitate a deeper understanding of the person's experiences and challenges, providing richer insights into their motivations and needs. AL in goals stands for active listening. Active listening involves fully concentrating, understanding, responding, and then remembering what is being said. This might involve nods, verbal affirmations like, "I see," or paraphrasing the speaker's words for clarity, e.g., "It sounds like you felt overwhelmed because..." Active listening validates the speaker's feelings and thoughts, building trust and openness in the relationship. It ensures that the individual feels heard and understood, which is crucial for effective support and guidance. S stands for summarizing. After a discussion, briefly summarize the key points to ensure mutual understanding and to reinforce important details. For example, to summarize, you're planning to apply for 3 jobs this week, and you will start by updating your resume tomorrow. Summarizing helps clarify the discussion's outcomes, ensuring both parties are on the same page. It reinforces commitments and the steps needed to achieve the discussed goals. F for focusing. Focusing involves steering the conversation back to the goals and keeping it aligned with the overall objective. When discussions veer off track, gently redirect by saying, "Let's revisit your main goal to see how this relates," or break down larger goals into more manageable tasks. Focusing keeps the session productive and progress-oriented. It helps individuals avoid becoming overwhelmed by the big picture by concentrating on actionable steps. Focusing also helps break down bigger goals into their smaller related goals. V stands for validation. Recognize and affirm the individual's feelings and efforts, regardless of the outcome. Validation can be expressed through phrases like, "It's completely understandable you felt that way," or "Your effort in trying this new approach was really commendable." Validation boosts the individual's morale and self-esteem. It encourages them to continue making efforts and acknowledges the difficulties they face, fostering resilience and persistence towards their goals. Integrating goals FV in peer support. Consider a peer support scenario where an individual is struggling with job search anxiety. Start by setting a clear goal, like drafting a resume by the end of the week. Use open-ended questions to explore their anxieties, listen actively to understand their specific challenges, summarize their feelings, and plan to reinforce understanding. Focus the conversation on small, manageable steps, like updating one section at a time, and validate their feelings of anxiety while praising their progress. Effective communication. Effective communication is essential when seeking help, especially regarding mental health issues or substance use challenges. Establishing open and supportive communication channels can greatly aid in understanding and addressing one's needs. Here are some key principles of supportive communication that play a crucial role in this process. 1. Rapport. Building a friendly and harmonious relationship is essential. Genuine interactions and shared experiences help establish rapport, making it easier to communicate openly and honestly. 2. Respect. Recognizing the worth of the person seeking help is vital. Peer supporters and facilitators should view individuals they serve as valuable resources deserving of respect and dignity. 3. Listening. Actively listening to what is being said is fundamental. This involves giving full attention to the speaker without distractions, making eye contact, and patiently waiting for them to finish before responding. Restating or reflecting on what has been discussed demonstrates understanding and fosters trust. 4. Open-ended questions. Encouraging individuals to share more information through open-ended questions promotes deeper communication. Asking why, how, and what allows for more nuanced responses beyond simple yes or no answers. 5. Permission. Questions. Asking permission before probing into sensitive topics respects the individual's autonomy. Empowering them to choose whether to answer certain questions fosters trust and cooperation. 6. Trust. Trust is the foundation of effective communication. When individuals feel respected, listened to, and empowered, they are more likely to open up and seek help. Communication strategies that demonstrate active listening. Active listening strategies. 1. Relating statements. Sharing personal experiences or feelings to demonstrate empathy and understanding. 2. Validating statements. Acknowledging the emotions and experiences of the speaker to affirm their feelings and perspectives. 3. Reflective statements. Repeating or paraphrasing what the speaker has said to ensure comprehension and show attentiveness. 4. Summarizing. Condensing and reiterating the main points of the conversation to clarify understanding and highlight key takeaways. 5. Positive body language. Non-verbal cues such as leaning toward the speaker, maintaining eye contact, and nodding to convey interest and attentiveness. Barriers to effective communication. 1. Use of ought or should, imposing expectations or judgments on the speaker's actions or feelings. 2. Warning, judging, directing, criticizing or instructing the speaker rather than empathizing and understanding their perspective. 3. Over-reassuring or over-sympathizing. Offering excessive reassurance or sympathy can invalidate the speaker's feelings and diminish the importance of their experiences. Instead of imposing judgments or directives, it's important to focus on the individual's strengths and self-determination. By refraining from these barriers and embracing supportive communication strategies, we can foster an environment of trust and understanding. Crisis intervention. During support groups, crisis intervention techniques may also be needed during group time. Here is a reminder from Seminar 6 of RRPS Recovery and Mentorship of some critical steps involved with de-escalating a crisis. 1. Listen speaks for itself. 2. Stay calm and reassuring. The mentor should remain calm and composed, providing a reassuring presence to the mentee. They can use a calm tone of voice and nonverbal cues, such as maintaining eye contact and using comforting gestures to convey a sense of safety and security. 3. Validate the mentee's feelings. It's important for the mentor to validate the mentee's feelings and experiences without judgment or criticism. They can acknowledge the mentee's distress by saying, "I can see that you're feeling really overwhelmed right now, and that's okay. I'm here. I'm here to support you." 4. Encourage self-regulation techniques. The mentor can guide the mentee in practicing self-regulation techniques to help manage their anxiety or panic symptoms. This may include deep breathing exercises, mindfulness techniques, or progressive muscle relaxation. The mentor can offer step-by-step instructions and provide gentle encouragement as the mentee practices these techniques. 5. Explore coping strategies. Together with the mentee, the mentor can explore coping strategies that have been helpful for managing anxiety in the past. This may include engaging in self-care, seeking social support from friends or family members, or accessing professional mental health resources. The mentor can help the mentee brainstorm ideas and develop a personalized coping plan that feels manageable and empowering. 6. Offer practical support. In addition to emotional support, the mentor can offer practical assistance to help alleviate the mentee's immediate distress. This may involve helping the mentee to create a calming environment, such as finding a quiet space or providing a glass of water. The mentor can also assist the mentee in identifying or accessing resources, such as professional support services, including a mental health hotline or crisis intervention team if needed. Relevant self-help resources should also be explored and provided, if possible. Additional considerations. Follow-up. After the immediate crisis has been managed, it's crucial to follow up with the mentee. This could involve scheduling another meeting to discuss how they're feeling after the intervention and to reassess their coping strategies and needs. Follow-up reinforces the ongoing support available to the mentee and helps build trust. Documentation and communication. If applicable, document the crisis intervention in accordance with privacy policies and organizational guidelines. This helps in maintaining a record of the incident and the steps taken, which can be useful for future reference and in improving the support group's crisis response strategies. Communicate any necessary information to other relevant staff or support providers, ensuring the continuity of care while respecting the confidentiality of the mentee. Training and education. Continuously improving the skills and knowledge base of mentors through regular training on crisis intervention techniques is vital. This can include workshops, role-playing scenarios, and updates on the latest best practices in mental health interventions. Keeping skills sharp ensures mentors are well prepared to handle crises effectively. Creating a crisis response plan. Support groups should develop a clear, structured crisis response plan tailored to their specific setting and population. This plan should outline the roles of each group member during a crisis, steps for different types of emergencies, and contact information for immediate professional support services. Regularly reviewing and practicing this plan as a group can improve the group's readiness and efficiency in responding to crises. Building a supportive community network. Establishing a network of support involving other groups, organizations, and resources in the community can provide additional layers of support. This network can include mental health professionals, local emergency services, and other support groups. Having a well-connected network ensures that additional resources are accessible when a crisis exceeds the group's capacity to manage internally. Self-care for the mentor. Mentors must also pay attention to their own emotional and psychological well-being. Dealing with crises can be stressful, and maintaining one's own mental health is crucial to being an effective supporter. Mentors should engage in their own therapeutic practices and seek professional support when needed. Six-step problem-solving model. This model was designed by Kepner and Trigo in the 1960s. It has been expanded here with examples of open-ended questions that can be asked to encourage progress through the steps. It also has insights on what a supporter or group facilitator might suggest or keep in mind, such as in the implementation and evaluation stage. Problem solving is a critical part of both motivational interviewing and crisis management. For motivational interviewing, solutions to problems often involve a change being made. Moreover, for crisis management, we often need to solve various problems. Here are the steps involved in a thorough problem-solving exercise. 1. Identify and define the problem. What do you see as the problem here? So, what do you think is contributing to these feelings or this experience? 2. Analyze the problem and its causes. So, what do you think is the cause of this problem? If they say they don't know, ask, how might you determine the cause? Suggest, Ask the people involved what they think. Ask, "Can I ask you a question? Do you see yourself as contributing at all to this problem?" 3. Generate possible solutions. How do you think you can fix or reduce this problem? What would an acceptable solution look like? 4. Evaluate the alternatives and select the best solution. What do you think is the best solution? If you choose this solution, what is the most likely result? If you choose this solution, what is the best possible outcome? 5. Implement the solution. Do not be afraid of blowback. Many people on the outside of a change will feel threatened or feel defensive. Remember, this solution is to make an improvement in our lives. Don't let someone else's feelings stop you from making a change that will improve your life. 6. Evaluate the outcome and standardize the solution if successful. For supporters, follow up with the person regularly to discuss the outcome, to allow them to share their experience of implementing the solution, and ask them if they can use the solution in times where they are faced with a similar problem. During your practice facilitation group, that is the final step of your training process of becoming a radical recovery peer support facilitator. Each time you move through this problem-solving process with a participant during the open discussion section of the group, you will receive 3 additional points on your overall score. Moreover, when you follow up with a participant in later sessions to ask them how the implementation is going, you will receive an additional 2 points.